the whole world is suffering from this immune dysfunction. And it's the basis of so many illnesses, why this worked for so many illnesses. And so with everything from chronic stress, gluten, GMOs, autoimmune diseases, chronic infections, gut issues, all these things are causing the immune system to be dysfunctional. And so you have two sides to your immune system. You have Th1 and Th2 in general. So Th1 gets stuff inside the cell, Th2 gets stuff outside the cell. So they need to be balanced. What happens in so many different illnesses, even with just aging, your Th1 goes down and your Th2 goes up. So now you can't fight these intracellular infections. You get reactivating virus such as the herpes virus, shingles, the chickenpox comes out, and you can't fight those infections, but you have too much inflammation going on. So increased heart disease, autoimmune disease, and then when you get the autoimmune disease or allergy, that makes it worse. So it's continually driving the body in this direction and causes so many things, and which is why we see with, for instance, Lyme disease, almost everyone, if not everyone, has autoimmunity. They have, we're finding now antibodies to the brain, which they're calling, basically it's a version of PANDAS, which is normally childhood illness, where the strep infection, the body cross-reacts and attacks the brain. That's going on in the majority of Lyme patients that we are testing. And so the key for treating Lyme disease, the key is treating the immune system. If you fix the immune system, you get rid of the Lyme disease. Most people who have Lyme disease have no symptoms. That's the problem. And when you look at a lot of these tests and they come out, the FDA will say, oh, that's an inaccurate test because people who have no symptoms turned up positive. But guess what? 5 years, 10 years later, when they have a significant stress, family, basically death in the family, divorce, emotional trauma seems to really be able to trigger it, but also, let's say, a car accident or another infection or a cancer, all of a sudden, boom, it hits. Now the body can't suppress that Lyme. It comes out, suppresses the immune system more, all these other infections, so which is why Lyme patients, they have usually 5, 10, 15, 20 other diagnoses which aren't necessarily incorrect, but it's what's causing it. And it becomes a chicken or the egg saying what causes. So you have to treat all those different components so now the body can actually fight the infection. And that question comes up, and it's a very good question. What is Lyme disease? And people say, well, it's an infection by the Borrelia burgdorferi, but it's a lot more than that. And we're finding the problem is that it usually is asymptomatic. There's so many different forms of it that some people that get Lyme, when we call Lyme disease, is typically thought of when people get acute Lyme. They get bitten by a tick. They, a week or so later, they get flu-like feelings and a rash, and they have the typical syndrome treated with antibiotics that goes away. But that's a fraction of the people that have chronic Lyme disease. Chronic Lyme disease is very different. It basically, you usually don't know when you got it. Majority of people have no idea. They've never been really high risk for a tick infection, for a tick bite, and they go along no problem. All of a sudden, middle age, they start getting stressed, that immune system starts shifting, then all of a sudden they get hit. They're like, oh my gosh, what's going on? I've been diagnosed with fibromyalgia, been diagnosed with chronic fatigue syndrome. So it affects almost every cell in the body. And it's very slow growing, very resistant, and which is why there's all these controversies. And they'll say, for instance, well, if it's Lyme disease, you treat it for 3 weeks of antibiotics, oh, they're not better, then it can't be Lyme disease. And we had the same thing with chronic fatigue syndrome, where we would have patients come in, we published our studies, we had 500 patients come in, they had seen on average 7.2 physicians without any improvement before seeing us. After 5 visits, they basically had dramatic, some dramatic, significant, and any improvement in their overall sense of well-being was hugely significant. And their energy level doubled and all this. And patients would say they'd show it to their doctor, and they'd say, well, you obviously didn't have chronic fatigue syndrome because it's incurable. So you get all this basic, roundabout arguments that, well, if that helped, then it's not chronic fatigue syndrome. If you find out what it is, what it's from, then it's not chronic fatigue syndrome. And the same thing with Lyme. I think majority of high percentage of patients with chronic fatigue syndrome ultimately have Lyme, or I prefer to say either, I don't even like tick-borne illness, because ticks are probably not even the most prevalent way of where we're getting transmission. Sexual transmissions, fleas, basically in utero is huge. And that's how I got into this, was basically I've been sick my whole life with no one knowing what's going on. I had one pupil bigger than the other, anisocoria, which usually shows that there's some damage, nerve damage going on there. They're fine now, but 20 years ago, people were like, well, what's going on? Weird flushing, my right arm would stop working. Got diagnosed with chronic fatigue syndrome before it was chronic fatigue syndrome, and fibromyalgia and all those things. So that's what kind of led me into this path by, being misdiagnosed, and the same thing, how many times was I told that I was depressed and just stressed out? I'm not depressed. Yeah, I'm stressed, but that's not the thing. And so, when you find so many things, and medicine moves so slow, it's especially the Journal American Medical Association and Annals of Internal Medicine show, they looked at what does a doctor know? And they found a doctor is practicing 10 to 20 years behind what's available in the medical literature. They found it takes a proven new concept, to take 17 years on average to get accepted into mainstream medicine. So when something's proven, they go to their doctor and say, well, if this works, why isn't everyone doing it? Well, in 17 years, they will be doing LDN and these other things. And many people are skeptical about Lyme. It's good to be skeptical, but we find a lot of times it's very good to be skeptical. And that's what we want. We want healthy medical debate. But unfortunately, that hardly ever happens anymore. It's become so polarized, so political. Are you with us or against us? And I'm not married to any treatment or any diagnosis. If basically a patient comes in, all the symptoms fit Lyme disease, okay, do you either diagnose them with 42 different diagnoses, or does this make sense? They turn out positive on tests, you give them treatments, they get better. I believe it's Lyme disease. It may be some other infection, and I'm open to that, but so many doctors aren't. And so the big question is, why is that? Why do so many doctors say it's unproven, it's quackery, people trying to make things up? And it's an interesting question. It goes to a lot of basically human feelings and emotions, and also the medical system. So if a patient goes to a doctor and that doctor can't get her better, he feels terrible. But how can he feel better about him or herself and say, I don't believe that person's helpful, I don't believe it's a real illness? So either, now, and if they believe Lyme, now they're going to have to go back and spend tons of hours trying to learn about how to treat Lyme and treat this patient, and they don't have time. They don't get paid extra for doing that. They just, they basically paid colds and flus, but you have one complicated Lyme patient that involves the entire system of the body. That's the problem. Who's supposed to take care of this person? And you're just clogging up their time. So it's so much easier for them and serves them well emotionally, financially, to say this doesn't exist. I'm not a bad doctor. I don't believe in this. I'm sorry for you, but you have depression and there's no proof that anything. And it's interesting. And they found, and when I mentioned it takes on average 17 years for a proven concept to be accepted in mainstream medicine, they found, well, again, why is that? And one, doctors don't read medical journals. They don't have time. There's no incentive to do it. Why should they find out some new treatment? Everything's dictated by the insurance companies. So you basically, doctor goes in, how does the doctor make the most money? You see as many patients as he can, make the quickest diagnosis, and get that medication to that patient and get them out. So all of a sudden you add all these different systems. The patients are very complicated. The doctor has to be a doctor. He has to be a medical detective. And again, there's no incentive for them to basically do that. So it's, and then they also found, again, that when doctors, they want to keep it simple, get the patients out, and they resent those patients that they can't get better, because if a doctor can't treat it, the doctor feels it doesn't exist. Right, who's going to pay for that? And that is a good question on, is there some of this controversy in Lyme driven from a financial standpoint by insurance companies saying, hey, we're not going to pay for this? Absolutely. Lyme is a horrible illness, and it's horribly expensive because, especially if they had it for a long time, it takes a long time to get better on most cases. And then where they look at, again, you're going to believe the data that supports what benefits you. So the insurance companies look at the data that said 3 months of antibiotics didn't make the patient significantly better, although there are some that show it, some that it didn't work. My response wasn't long enough, and we can do a lot of other things that do help the patient, but they use those to say, okay, we can deny treatment. And it is expensive illness, so they're looking at it from a financial standpoint, and doctors too, where they can see 10 patients and get those patients better easily instead of taking on this one patient that they don't know what to do with, and it ends up being more of a conflictive relationship between the doctor and the patient and the insurance company because, again, they have different goals in mind. Yeah, and you hear, yes, that Lyme disease, mimics other illnesses. Syphilis was known as the great imitator. It imitates other illnesses, and whether that is a smart thing, that it's going to try to show you it's something else. I think it's really fits with the pathophysiology of the illness, and that so many illnesses are driven from the same underlying problem, which is the abnormal immune system. And we're finding, now it seems like everybody's sick, and the rate of chronic fatigue syndrome, fibromyalgia, asthma, diabetes, all these things are immune dysfunction. That is at the base. Again, that Th1, Th2 is like this. People get more cancers, more diabetes, inability to lose weight. These infections are driving that, so you're getting all those same, basically, symptoms. And we're finding, what's a symptom of Lyme for us? One is type 2 diabetes. Usually it's Babesia, so a co-infection of Lyme. So it's this chronic inflammation that causes so many things, and it becomes a chicken or the egg. The inflammation suppresses the pituitary, which then causes low hormones, so now you get hypothyroidism, which now there's no energy for the immune system, that goes down, body can't fight the infection, gets worse and worse. And that's why we look at it as such a multi-system illness. And and so many people say, well, it's the same as saying, what causes chronic fatigue syndrome? We can show that it's basically neurotransmitters in the brain, it's sleep, that it's gut, it's mitochondrial dysfunction, it's pituitary dysfunction, it's low hormones, chronic infection, immune dysfunction, coagulation defect. Well, what causes it? Well, who's right? Well, they all are, because it's a vicious cycle. And the way we practice medicine is that we compartmentalize everything to make it more understandable. But when you do that, you basically miss the whole picture. It's kind of like the blind man with the elephant and them, feeling different parts. And that's the problem with these patients is they go from doctor to doctor to doctor, and this person sees that one little part, says, oh, you have this. You go to the rheumatologist, you have autoimmune disease, or they can't figure out which one it is, so they say it's undifferentiated, autoimmunity, and they treat them with immune suppressants, and it makes them worse. So there's so many problems that every specialist just treats one little part and doesn't see the whole picture, which is why Lyme is so horribly treated in this country and really around the world. For most patients that see us, we have a mixture. A lot come in and say, I'm tired, something's wrong, my doctor can't find anything, all the way from, I've got Lyme, I've been to so many different doctors. There certainly is much more awareness in Lyme, but again, there's also resistance. It becomes kind of like the vaccine controversy, who's right, and it matters what literature you look at, and literature also very biased. You look at the conclusion of a study, you have to just look at who funds it, and you're going to see what the conclusion is. It's always tweaked. So yes, I really think Lyme is exploding, and not even for the reason that there's more infection, but I think there's more other things going on. And patients would be fine and with chronic Lyme because their immune system is fine, they just suppress it. And we check that, so we check everyone's immune system, and we'll tell them sometimes that they come in, they're tired, and really no other symptom, just that, or come in for something completely different. We find they have low immunity, then we'll check their Lyme test, and it's positive. We say, you are at significant risk for getting chronic Lyme, chronic fatigue syndrome. I mean, you have chronic Lyme, but it's not affecting your life. You don't even have any symptoms. So with those people, if you keep the immune system up, make sure you get rest. It's hard to stay away from stress. How do you do that? but we've seen that in families where the whole family's sick but one person. And this was also shown in a Stanford study where they had chronic fatigue syndrome patients. They had their blood 3 years before they had symptoms. What they found is they had low immunity, but they didn't get that inflammation yet. So they had the low Th1, but that Th2 didn't spike. So they were at risk, and then it just took something else to just set that off. And we've had people who come in and for some reason we check their immune system and say, you're at risk for chronic fatigue syndrome. And this was before the Lyme whole thing kind of came out as a cause of chronic fatigue syndrome, and say you're at risk. Like, well, that's crazy, And then 5 years, 7, 10 years later, they come back, oh my God, I got chronic fatigue syndrome. So you can spot those patients and you can see that pathophysiology of it. And it's also genetic. You're prone to people that get Lyme if you have, nothing's good or bad in terms of matters what environment you're in. So you have a lot of people have basically a gene that clots very quickly. At some point in our ancestry, that was good. Whenever you get cut or bitten by something, you clotted quickly, you're going to survive. Now it's a negative. We're living longer. Basically, people have more strokes and heart attacks. And we're finding with Lyme, you get a number of different things. Is you get immune activation of coagulation. So the body lays down fibrin along the vessel, not a clot, but fibrin. And what happens, oxygen now cannot get into the cells very, very easily, which normally takes 2 seconds to get in. It takes up to 2 minutes. So the cells are starving for oxygen. And we do a little test for that, and people they'll complain of air hunger. Is that if people take a breath, hold out, blow out all your air, and then you check a pulse ox. Now, a normal person, as the oxygen goes in the lungs, and then into the capillaries, then into the cell, now that oxygen level will drop because there's nothing replacing it. With Lyme patients, majority of them, you see that doesn't drop, so it's not going anywhere. It's just staying in the blood. And we're also finding that so many Lyme patients have autoimmune things like antiphospholipid syndrome, and then so you start getting this overlap of autoimmunity, hypercoagulability, and things causing this whole array of symptoms. So it's why there's so many different presentations of Lyme. And it is controversial, and yep, and in the question about is it sexually transmitted? And you look at the studies that showed, one study showed it was in 100% of vaginal fluid and 50% of seminal fluid, or it was the other way around. But, and with the question, is that transmittable? But they have found that couples together, basically one person has it, now the other person has the same strain. So it looks very likely that sexual transmission is possible. And you look at the way Lyme is spreading, it's not going where just how the ticks are spreading. So there's some other mechanism. Also mosquitoes. The one study, they had hamsters in a cage. They put basically hamsters with Lyme, put them in a cage. Mosquitoes fed on them. Then they put them in the mosquitoes in a cage with hamsters that were Lyme free. 20% basically showed exposure to Lyme disease. The conclusion of the article was that mosquitoes do not seem to be a significant transmission route of Lyme. 20%? It's not so. So you can see how a lot of this, doesn't get news. Where, oh my gosh, 20% of all the mosquitoes are exposing people to Lyme. That's serious. Yeah, and you look at in certain journals in terms of biasness of studies, and everyone has an internal bias, and in what you see that works. I have certain therapies that I know that work, so I'll tend to use those more than another doctor. And how whatever interactions and historical events happen in your life, you have a different bias. If you have that illness, you're going to know a lot more, but you have a particular bias for that. But in each journal, pretty much you can tell what the conclusion of that article is going to be by what journal is in it. Then you look at who funded it, and you pretty much got how that's going to be bent or spun. For instance, on medications that stop bone loss. One study, the product basically said it went from the person lost, the people on placebo lost 2% of bone, on the medication 1% bone loss. So they said 100% increase in bone decrease in bone loss. The other people said only 1% decrease. Well, they're both the same, but it matters how you want to say that and who benefits from characterizing it in that way. Yeah, and it's interesting. Why isn't this, outcry of experts and people saying, "Oh my gosh, this is the worst, the highest risk sexual transmission, and how many more people have Lyme than are suspected." And I think it's one of those things that it's very slow growing. Most of the people that get it won't have symptoms for 10, 20 years. But I'm just noticing it seems that every person I talk to, either them or a family member has got some serious illness that the first thing I think of is Lyme. They got chronic fatigue syndrome, fibromyalgia, they can't get out of bed, they have MS, and it's just exploding. And people say it themselves that why is everyone sick now? Even the obesity, and there's good evidence that obesity is infectious. So I think all these things are a problem. And the government, it's when do you basically, pull the cord and say, oh my gosh, we have an emergency here. You don't want to scare people, and so there's a balance. And when you've got certain numbers of experts, why is there an incentive for them just to deny the facts? And you look at, basically these studies, and again, I mentioned that why it takes 17 years for a proven new concept to get accepted. I said, doctors don't read medical journals, but a bigger issue was when if you give a doctor, here's 50 articles proving the way you're doing it isn't the best. What does that doctor generally do the majority of the time? Say, I don't believe those articles. That's what happens. He doesn't say, oh, you know what? Thank you for bringing these to my attention. They basically just say, I don't like those articles. You find, something wrong with them. Oh, they're not long enough. They're not placebo-controlled. But you found these studies to be adequate. But so again, doctors will believe what they want to believe, and they're human. And the reason why very intelligent doctors, caring doctors, that get a patient from them and say, I don't believe this. And again, you can show them the studies and they say, well, I don't believe those studies, and it just makes no sense. And I think it does come down to human nature, that the doctor, unless he or she is willing to put in tons of time to research this and figure out how to treat the patient, which is very difficult. This is what we do, and I can't treat a patient in 8 minutes. I mean, you can't run a practice the way standard medicine wants you to and see 5 patients a day. You can't. So to that doctor that says this doesn't exist, the Lyme patients are his enemy. And that's the way that it is perceived to them. And again, they're going to, they want to go home and sleep at night and feel they're a good doctor. Easiest way to do it, say, oh, it's not my fault, it's their fault, it's made up. And also we found, one thing, and we found that the more adamant a doctor is, the more adamant that they're right, no such thing as Lyme disease, absolutely not, or your thyroid is normal, there's nothing wrong with you, the less they know. And as you basically become more, read more, and the more that you study, the more you know we don't know. And so many doctors are absolute. There's nothing wrong with you. Well, you did a CBC and a chem panel and say we can't find anything. Well, if you don't look, you're not going to find it. And I think that's a big problem with so many doctors against it. What do you want me to do? Run 100 tests? Well, sometimes yes, you need to do that, but they can't. So then they're now have to try to fight the insurance company and try to get these things paid for. Now that even an hour visit just turned into 10 hours of their staff time and do that, these patients are very difficult and they're thrown into a system that is not made to get them better. And the question, why don't some patients respond to antibiotics? I think it's certainly multifactorial. And the key determinant is the immune system. So if you have an intact immune system where good Th1, Th2 isn't elevated yet, and you get Lyme, you can treat that. If you get antibiotics on board fast enough, good chance you're going to get rid of that infection. Now, the longer you have it, as soon as it basically shifts, what it does, Lyme will drive the immune system, lower Th1, and then increase Th2. So now it's going to be killed extracellularly, but then it goes inside the cell. So now it's shifted the immune system so the intracellular immunity of the body cannot get it. At that point, you have now crossed the threshold where antibiotics on their own are going to be very difficult to treat the patient. It's like an HIV patient, and you look at, what's the risk for basically from HIV to AIDS. It directly goes from here's your Th1, your Th2. The line goes like this. This is the progression. As Th1 drops and Th2 goes up, they get worse and worse and worse and worse and worse. And that's exactly what happens with Lyme, is that you can't fight the infection. You cannot take enough antibiotics ever to kill Lyme unless your immune system is there to clean it up. It just doesn't work. So really the one determinant really is the immune system. Yeah, and so question comes, how do you treat a Lyme patient? And that's one thing. You can look at the patient's immune system, you can tell if it's acute, chronic. We do a large panel of tests, which are becoming more and more difficult to get because insurance companies, but we can pretty much pick out a Lyme chronic fatigue syndrome fibromyalgia patient 80% or so of the time, and likely how severe their symptoms are. So we can actually tell those things from a blood test without talking to the patient. So when people say they don't believe in these things, say, well, we can, put with just their labs, we can pick them out. Hey, they're not making it up. So really, again, how do you treat chronic Lyme? Antibiotics certainly may be a part, but we found once you reach that threshold on their own, they're likely not going to be successful. You have to do other treatments. If you don't fix the immune system, the patient doesn't get better. And again, becomes chicken or the egg. Well, how do you fix the immune system? The best way is get rid of the infection, but how do you get rid of the infection if you don't have an immune system? So that's where these immune modulators come in. And then we're finding too, when you have, again, this Th1, Th2 problem, now you've got autoimmunity issues causing inflammation, dysfunctional pituitary, sleep dysfunction, pain. Well, how do you suppress this part of it? And then if that were true, just lower that, just give prednisone. People feel better, but then again, it lowers both Th1 and Th2. Now, overall, they're worse. It actually goes deeper into the tissues. So the key is, again, the multi-system treatment, and really remembering that immune system is probably the number one key to success.
So how does LDN help with the immune system?
So an LDN basically does what we want it to do, is will shift that Th1, Th2. It will lower inflammation, but increase that good immunity. So your body can now have a chance to fight those intracellular infections. Yeah, and there's so many therapies for Lyme patients that work, and there's so many therapies that don't. But oftentimes they're the same treatments. One patient says, "Oh my gosh, this was amazing." Other person says, "That didn't do anything for me." And it depends on the person, the strain, the co-infections, where in the stage of treatment they are. We'll find patients tried something early on, it didn't do anything for them, but after you make progress, that same treatment is profoundly effective for them. So there are a lot of treatments that are go-to, and again, most of the treatments that are really known to work for these chronic Lyme are immune modulators. Ozone. Yes, it does directly kill, but I believe more of the benefit is really that immune modulation. So ozone is great. It works like LDN. IVIG, another one, can be a miracle medication for people. It shifts that immune system. Now no thing's perfect because the immune system is very complex and it's oversimplification, but IVIG also can lower natural killer cell function. So too much may not be better, and it depends on timing, stage of the illness, and so many factors. And we're learning tremendous amounts, which is nice. There is more acceptance in mainstream medicine, and we just spoke at the last ILADS conference, and I couldn't believe the number of doctors there and the number of mainstream doctors. So I think we're getting close to a tipping point, I hope, and it is now becoming, you can only ignore the literature, for so long. And at some point, they're going to have to say, doctors hate, I think, to say, "Oh, you were right, I was wrong," more than anybody. So I think that's part of it. But you got to give them an out and say, "Well, we were partially right," and then that's what I think. I think both sides have good points. but it becomes a particular battle. Really, it's about, hey, everyone wants to help the patient in general, but they have different views, and really it's about what should you try to do for cost. Hey, I have all these treatments, and we find most treatments work for about 20% of people. So you say, well, is that a good treatment for Lyme? It only helps 20%. I can see argument yes or no, but if you try enough of treatments that work for 20% of people, you're usually going to find the one or the combination of things that work. Now the problem is, again, you have interactions, you have costs, and you try treatment A doesn't work, you try treatment B doesn't work, you try treatment C, it doesn't work, but then you do them together and it works. So it's a very complex treatment process, and it's very individualized. And doctors don't like individualized. And you hear about individualized care, and you hear like translational medicine, which means taking the basic medical literature and applying to that patient, applying it to your patient. The thing is, you do that, you're going to get labeled a quack. Like, I'm doing this treatment, why are you doing that? No one does that. Well, I'm basing it, here's the research article. And that's what you're told to do as a good doctor, but in practical terms, no one does it. And that's what really has to be done with the Lyme patients. And the good thing is you're having a lot of very smart people doing that. And that's where the progress is coming from with Lyme, rather than the drug companies looking for that one super drug that's going to do it, which would be great if they can, but that's a very low likelihood. It's these all other pioneering doctors that are finding new methods, and unfortunately, with all the regulatory issues, doctors are getting more scared to do these things. And that's the thing. So the doctor, where's that incentive? There's no incentive for them to go get this information. And a big problem too is when you look at, what do most doctors look to for, how best to treat their patients? It's usually society guidelines like Endocrine Society or the Gastroenterology Society. And they have found, if you look at the rankings of how powerful or reliable the evidence is, you have the highest is randomized, double-blind, placebo-controlled trial. Then you basically have anecdotal stories. Societal guidelines are below that. They are shown to be the worst form of evidence because they're almost always wrong. They're stuck there 15 years later. You need to have a consensus to make a change to it, and they're just so behind. And so it's one of those things, and that for doctors, they're all burned out because with all their paperwork takes more time than seeing the patient. Then they don't get paid for the extra time with a difficult patient. It's just why should they? I think that's the question, and the whole model is broken, which really is this insurance model that is the problem. When here in America we're trying to get this healthcare reform, I couldn't stand it myself. I'm a big advocate of healthcare reform, and so I just wrote a paper and I sent it off to as many people as I can. So we'll see, but I agree that there's human nature, and then the system works against doctors. The more basically uncaring a doctor is, the more money they're going to make. If a doctor can see a patient, just say, here you go, and just get the patient out, they're going to do pretty well. They're going to see 60 patients in a day. As soon as you start caring, you're going to be frustrated because you can't treat this patient that really needs treatment. But if you can blank that out and convince yourself that it's not you, it's the patient, this patient's just crazy. Yeah, see, it happened after some emotional thing. It's a woman usually. And they can convince themselves that, hey, they aren't the bad person. They're just the doctor. And this is, evidence shows that this is a fake case. So that now they can go home and sleep. And it's a problem. It's in terms of the financial issues with Lyme and every other illness, and you look at the model is now, it's basically currently you don't need a medication until you're sick enough. And basically so 90% of the healthcare dollars are spent in the last 5 years of a person's life. And that's where all the money is. No one wants to spend it earlier, which would be much more cost effective. But insurance companies don't want to do that. You say, well, they'll save money in the long run but you'll probably be with different insurance companies. They spent the money to save it for someone else. But it is a problem. This is not an illness for the poor. It is very difficult to get treatments. The best treatments are expensive, no doubt. And it is a knowledgeable patient. And it's interesting where I encourage patients, go on the internet, look up all the information you can, come back and we'll talk about it. But so many doctors, if a patient does that and walks in with articles, says, I've been reading on Google, they stop reading on Google, you don't trust me, is if you find a doctor like that, run. And unfortunately, most patients with Lyme know more about Lyme than their doctor does. And one, they don't have time to think about it, they don't know about it, and what's their incentive to learn about it? They'll just get more of that same patient that's not going to make them any money. And it's heartbreaking, and it's a very difficult situation. And in my healthcare reform plan, I do have some things I think to help reform the whole healthcare system, because it's just in the U.S. it's imploding. Healthcare for things you need on a routine basis, insurance model never works. It's basically, let's say food's important, right? Let's say we had food insurance. You go into the store, you go, hey, chicken's healthy and cheap. I'm gonna get some chicken. How much is the chicken? Well, we don't know. It depends on what insurance you have. Well, let's bill your insurance. Okay, then you go eat the chicken, get home a month later, you either get a bill for basically, no, the chicken was $2,000 and we paid $1,500 of it and you owe $500. Or they could say nothing, that basically it was not allowed, you should have bought a hot dog and you owe $2,000. Or they could say, we paid it. They charged $2,000, we cut it down to $1,800, and then we paid that $200 or $195, you owe $5. You don't know. What industry works like that? That is the way medicine is. You have no idea what the services cost, and patients say, I want this test, and the prices, it's like for a lab, they'll charge $800, but you can probably get it for $30 somewhere. And the whole system is a mess. So, and then add a complex illness to that, and this is the mess that we're in. And when you look at chronic Lyme and successfully treating chronic Lyme, what is the key? The key to the diagnosis and understanding where they are in the chronic illness phase. Let me scratch that. I was going off in the weeds too much. What was the question again?
LDN and Lyme.
Yeah. So when treating chronic Lyme, the key is the immune system. That is the one thing that's going to make or break the success or failure of your treatment. LDN is one of a number of treatments, but it is a great starting point because it is cheap, extremely safe, and effective. Does it work for everyone? No, nothing does. But treating the immune system is the key to successfully treating Lyme.